All right, I think we're going to go ahead and get started, and then people can just join as they come in. So hi, everyone. Thank you so much for joining us this morning. My name is Rose Schnabel, and I'm with the Free the Pill campaign. So for those of you who don't know, tomorrow, Saturday, May 9th, is Free the Pill Day. And tomorrow we celebrate 60 years since the FDA approved the birth control pill in the US. The birth control pill allowed so many people to take control of their careers and plan if, when, and how to start their families. Today, millions of people use birth control to take charge of their reproductive health and lives. But despite this progress, we still don't have a birth control method that works for everyone. So that's why tomorrow, on Free the Pill Day, we're fighting for a birth control pill that's available over the counter, so without a prescription. It also needs to be affordable, covered by insurance, and accessible to people of all ages. As somebody who recently turned 18, that last piece about no age restriction is especially important to me. I think it's about time that we recognize that young people know what's best for them and for their bodies, and offer them all the resources possible to take control of their reproductive health. So today, as a part of our Digital Week of Action, we're doing a Q&A with Dr. Sally Rafie, a pharmacist, to talk about why this is the moment for over-the-counter birth control and the essential role that pharmacists can play in the provision of contraception. Hi, Dr. Rafie.
Hi, Rose.
Thank you so much for joining us today. To start off, could you tell us a little bit about your background and how you got involved in the birth control movement?
Yeah, I'm so honored to be part of this and part of the movement, especially, given everything that's going on right now with the COVID pandemic. I think it's made it even more clear why we need an over-the-counter birth control product. So a little bit about me. Back when I was in pharmacy school, I was always very passionate about reproductive rights and women's right to choose and have access to everything that helps them take care of themselves. And when I was in pharmacy school, I started to see, I can actually help deliver services as a pharmacist. And that really opened my eyes to the role that pharmacists had at the time. This was almost 15 years ago, as well as the role they could have. And so I've really been working over the last 15 years to expand the role of pharmacists in providing family planning and reproductive health services, and we've come a long way since then. So I'm really proud of the expanding role of pharmacists in delivering care. Most recently, in the last few years, pharmacists have now begun to be able to prescribe birth control directly to patients in some states, which is a game changer for some people. Yeah. And it certainly expands our role, and we really love to provide that service directly to patients. And to help support the rollout of this service in all the different states, we created the Birth Control Pharmacist Project. And that project is doing everything from helping to create legislation in states to advance this policy that allows pharmacists to prescribe birth control directly, to training pharmacists and helping them to get the word out to their patients that they actually offer this service. And for that reason, we created the Birth Control Pharmacies website, where patients can actually learn more about this service and find a pharmacy that offers it.
Wow, that's fantastic. Such a good resource to have. As I'm sure that you know, the Free the Pill campaign aims to reduce the barriers to accessing birth control so that everybody has the freedom to thrive. So could you touch a little bit about what some of those barriers are?
Yeah, I mean, we definitely see a lot of them in the pharmacy setting. There's the obvious things like time to get to a doctor's appointment or clinic appointment, transportation. People might need to get childcare arranged in order to be able to go for those visits. And then after they get the prescription at the clinic or doctor's office, they have to make another trip to the pharmacy potentially to pick up supplies. So we know there's lots of barriers. The health insurance plans typically only cover maybe 1 month or possibly 3 months of, like, for example, birth control pills at a time. So that means people have to keep going back to get more supplies. And all of this is just creating unnecessary barriers. Then there's some of the other barriers that people may not see kind of at the surface level. We could have someone who's had trauma in the past and doesn't want to have a physical exam, but then going into a clinic visit or doctor's office, if that particular healthcare provider is still bundling those services and requiring that patients get a physical exam, then that can, of course, be a barrier. We know not all healthcare providers provide the full range of options for patients when it comes to birth control. So then even though they're going to see a doctor or clinic, they may not be able to get the method that they want or learn about all the methods available to them. So that's an obvious barrier. And at the pharmacy, you know, we see people coming in all the time trying to purchase over-the-counter products. They may not even know that it's possible for them to, you know, use these other prescription methods. And how do we make it easier for them to do that? I think our healthcare system is just so intimidating, and there's a lot of work to do.
Absolutely. And as a young person, I totally get that about the healthcare system being intimidating and just kind of not knowing where to start, really. So I've heard from a lot of friends my age whose parents won't allow them to get a birth control prescription. And that's really alarming to me because we're entering this new stage of our lives, this transitional period. A lot of us are heading off to college or to a job for the first time, being away from our families. So, Sally, could you talk a little bit more about how those barriers that you discussed disproportionately impact young people?
Yeah, I think you nailed it on the head there in terms of it being so critical during this transition. Unfortunately, some states have laws that restrict minors' access and young people's access to services, which is not evidence-based. So we're really working to, you know, tackle those laws and embrace evidence-based policies, which means that the laws actually are based on science and data that we have, and we know that young people can make decisions about their bodies and take good care of themselves. So we would definitely want to allow that to happen. So some of the barriers you talked about, like having health insurance. A lot of young people are covered under their potentially parents' plan. And so there might be concerns if they do access these services that their parents would then receive a statement and their confidentiality would be broken, which we would not want to have happen. So there are some states that are starting to put in place policies where an individual, if they are, you know, worried about that, can submit a request to their insurance company and have certain statements not go to the primary insurance card holder, which is really important. I mean, it's a small detail, but it can make a big difference if it really breaches that confidentiality. So that's just one example, but you know, all of the things we talked about, whether it be transportation, getting time away from classes, also if you're going back and forth to college, your physical location changes. So being able to access a regular doctor or pharmacy might change as you move from college to back home. So there's lots of issues that affect young people, and we really want to make it easier for you all.
Yeah, absolutely. It's so important. So now that we've talked about all those barriers, let's take a positive spin. What are some of the solutions? How are we making it easier for people to get birth control, and what role do you play as a pharmacist?
Yeah, I think we've actually made some progress here in the United States recently. Of course, the Affordable Care Act does help people who do have insurance to access contraception at no cost to them, which has obviously been a huge game changer. And we've seen a big shift in people being able to pick the method that works best for them when they don't have to worry about the cost of it. So that's been huge, and more people just having health insurance. But we know not everyone has health insurance, and we need more options, which is why having the option to go straight to the pharmacy, to meet with a pharmacist, to learn more about their birth control methods, and have a prescription written and dispensed right there so the patient leaves with their birth control from the pharmacy in one visit has been really helpful. It's currently available in about 11 states and counting. We have 3,000 pharmacies across the country that are offering this service. We know it's just a small percentage of all the pharmacies, but it's a great start, and we're seeing more and more every month that are getting on board with this program and offering the service. But it certainly doesn't stop there. We want to see more birth control methods being developed and have more methods available in our kind of toolkit of what we can offer people. Mm-hmm. And I guess finally, because of our Free the Pill Day, I have to emphasize the importance of having things available over the counter. It's not, you know, some people love consulting with a healthcare provider, getting more information, maybe getting a personalized recommendation, but other people don't. And that might be, you know, circumstantial. Sometimes they're, you know, interested in talking to someone, and other times they're not. And so we just want people to have options. So if they'd like to meet with a healthcare provider, they can. But if they'd like to go ahead and just access something directly without getting involved with a healthcare provider, they should be able to do that too.
Yeah, I couldn't say it any better. And so what about in the States or in the pharmacies where birth control is available through a pharmacy consultation? What does that look like?
Yeah, it's pretty straightforward, but we do emphasize it's not the same as it being over the counter. So while we're working towards getting a pill approved by the FDA for over-the-counter sales, when pharmacists are involved, currently it's actually the pharmacist prescribing. So they do a health assessment similar to what a physician or nurse practitioner would do. So when the patient goes into the pharmacy, they'll be asked to fill out a brief questionnaire, and it'll just ask some medical history if you've ever had like breast cancer or liver disease. Those are some of the key ones. It'll ask about medications that you might be taking, and all of that is intended to help the pharmacist determine which methods of birth control are safe for that person to use. And if the patient's interested in using a method with estrogen in it, they'll also have a quick blood pressure measurement by the pharmacist. And at that time, hopefully, depending on their medical history, the pharmacist will go over all their options with them, and then the patient can choose, what they think works best for them. And the pharmacist can go ahead and write the prescription, share how to use the product, how to take it, what to expect, and go ahead and dispense supplies right then and there to the patient. Yeah, you can hop on our birthcontrolpharmacies.com website to learn more about this in terms of which methods are available, which states it's in, and you can actually punch in your address to see. Uh, are we back?
Yep, I think we're back. Let's see. I can see the link that you
Okay.
sent, so I think we're all set.
Yeah.
Awesome.
Awesome.
Well,
Thanks so much. Great questions.
yeah, of course. Thank you so much, Dr. Rafie. This is such helpful information to have as we call for an over-the-counter birth control pill. Especially now, as we're facing uncertain times during the pandemic, we can see how important it is to have as many options as possible and as many ways to access them as possible. So is there anything else you'd like to add?
Just keep up the great work. I'm happy to see so many people tuned in. We'd love to get you all involved.
Yeah, absolutely. So as Dr. Rafie said, thank you so much for tuning into our chat. And as we celebrate Free the Pill Day tomorrow, we know that we still have a lot of work to do, but we have some great motivations to do that work. So if you're interested in getting involved in the efforts to bring the pill over the counter, stay engaged with us. You can follow us on Instagram, Twitter, and Facebook, and also follow the hashtag #FreeThePill to see what we're working on. If you have a story about getting birth control, share it with us. We know the power of stories, so we would love to hear yours. Great. So thanks again to Dr. Rafie for chatting with us today, and thanks to all of you for tuning in. Stay safe.
Thanks, Rose. Thanks, everyone.